All right, welcome to The Explainer. Today, we're going to put on our detective hats. We're diving into the pediatric clinical research files of Dr. Luis Campanella to crack the case on a super common childhood illness, bronchitis.
You know the feeling. It's that moment every parent knows and, frankly, dreads. The sniffles were one thing, but now the cough has changed. It's deeper. It rattles in their tiny chest. Suddenly, it's 3 in the morning, you're wide awake just listening, and your mind is racing. That change, right there, that's our first clue.
So, here's our mission. We're going deep inside the pediatric airway. We're investigating that exact spot where a simple, everyday cold can take a very sharp and very wrong turn.
And this right here is the whole ball game. Our job is to figure out how to tell the difference between a head cold that's just hanging out and the moment it dives down into the bronchial tubes. Getting this right is absolutely critical, because it's the line between a few sniffles and a trip to the emergency room.
Okay, but like any good mystery, there are always false leads, right? Red herrings designed to throw us off the scent. And when it comes to pediatric bronchitis, the #1 false lead is the chase for antibiotics.
Oh yeah, we have all been there. You see that green gunk, and your brain just screams, aha, it's bacterial, we need the heavy-duty stuff. It's this piece of medical folklore that's been passed down forever, but I'm telling you, it's a clue that leads absolutely nowhere. It's a dead end.
So let me ask you something. How many viruses can a bottle of antibiotics kill? The answer is a big, fat 0. Nada. None. And that's because, well, the thing causing this bronchitis in the first place, it's almost never bacteria.
So let's just lay it all out, plain and simple. The myth is that green mucus means you need antibiotics. The reality, the overwhelming, vast majority of these cases are viral. So not only are antibiotics completely useless, they can actually cause real harm to a child's developing gut microbiome. You know, that whole universe of good bacteria they need to build a strong immune system? The takeaway is crystal clear. Chasing antibiotics is the wrong move.
All right, let's talk about false lead number 2, the cough syrup trap. And oh man, this one is so tempting. Why? Because it promises the one thing every exhausted parent is desperate for. A little peace and quiet, a little sleep.
I mean, the logic seems totally bulletproof, doesn't it? The cough is loud, it's keeping the poor kid up, it's keeping you up. If we could just stop it, everyone could finally get some rest and heal. But what feels like a logical step is actually a really dangerous detour.
Let's break this down. The myth says, stop the cough. But the reality is that the cough is not the enemy here. The cough is the body's superhero. It's the single most important defense mechanism for getting all that nasty infected gunk up and out of the lungs. Think of it like this. When you use a cough suppressant, you're telling your kid's security team to go on break, which basically locks all the bad guys inside.
Okay, so we've totally debunked the 2 biggest myths. No more chasing antibiotics, no more trying to silence the cough. So, what should we be looking for? It's time to stop paying attention to the misleading clues and focus on the hard evidence.
Okay, I need you to lean in for this part, because this is the real turning point. Forget everything else for a second. These next few clues are the only ones that actually matter. These are the undeniable, non-negotiable signs that your child is in real distress and needs help right now.
Here they are, the 3 true red flags. And these are not up for debate. They are crystal clear physical signs. We've got nasal flaring, chest retractions, and lethargy or cyanosis. Let's dig into exactly what you should be looking for with each one.
First up, nasal flaring. What you're looking for here is their little nostrils flaring out, getting wider with every single breath they take. It's an automatic reflex. It means their body is working way too hard just to pull enough air into their lungs. It's a clear sign of a struggle. Second, chest retractions. Now this is another really powerful visual cue. I want you to look at the skin right around their ribs or at the base of their neck, near the collarbone. When they breathe in, do you see the skin suck inward, creating these little dips? That tells you their chest muscles are in overdrive. They are struggling to breathe.
And now for the third and most urgent red flag, lethargy or cyanosis. And look, we're not talking about just being a little sleepy. This is an extreme, kind of floppy exhaustion. And cyanosis, that's a visible, bluish tint around their lips or on their skin. It's a direct sign they are not getting enough oxygen, period. If you see this, the investigation is over. It's time to act immediately.
So, we've followed the clues, we've thrown out the false leads, and we've pinpointed the hard evidence. Now it's time to put it all together in your final case briefing. This is your action plan.
Here it is, your 3-step protocol to get a true grip on this.
It's super simple. Number 1, hydrate. I mean, push those fluids like it's your job. Water, juice, whatever. This thins out the mucus and makes it easier to cough up. Number 2, monitor. You are on watch. Your only job is to look for those 3 red flags we just covered. And number 3, act. The second you see even one of those red flags, you know what to do. No hesitation. You go to the emergency room.
So at the end of the day, remember this. Real control isn't found in a bottle of cough syrup or antibiotics. It's found in what you know. You have the intelligence brief now. You know what to ignore, and you know exactly what to watch for. So the only question left is, are you ready to be the calm, informed expert your child needs you to be?